You were able to provide such, comfort's not the right word, because I'm not sure anybody was comfortable with the library, but a certain peace of mind that you were able to give to me, that this was something that even though we didn't know it yet, we would be at the cutting edge of everything that happened, that we would be as well or better informed than anyone else, that we would be making decisions that were motivated by science and not politics, that we would be doing everything we could with the paramount focus on saving and protecting people in our community. You also recognized that there was a political side to this too. There was a community that was looking to see how it should react to ours. A community that was wondering themselves whether they would be okay. A community that wanted to know that its city and its leaders were going to be taking care of them. That measure of trust and willingness to act in the face of what was beginning to be an increased politicization of the issue that we fought really hard to avoid. That measure of trust that our community had, I think, was due to our staff, the response we had, all of Austin Public Health, the work we did together with Travis County. It was everything, but that was embodied with you. And you were the face that people saw, and yours was the voice that people heard. You empowered me to be able to reflect that sentiment and talk to the community, and you just saved lots of lives. So for all of that, I wanted to reward to you a key to our city, and just say thank you so much.
Thank you, Mayor. It is a giant key. Mayor, I appreciate that, and we visited a little bit at the reception for the outgoing council members, and one of the things that impressed me about you early on was a discussion that you and I had. So I talked to the mayor about that. I want to be in the room. I want to be informed about everything. I want to be part of the discussion. And that was really profound for me, not just for this situation, but as a leadership lesson. Because it's that interaction that led to a deeper understanding. It led to us bringing in the CEOs and CMOs of the hospital systems, the superintendents of the school districts, all of the Zoom members that we met with so often for such a long time, that not only helped inform the policy, but it also created champions for that policy. Too often I think leaders isolate themselves and they want to make the decisions and don't have that sense of transparency. And I think that's really why the city's policy was successful, the county's policy was successful, because you and the judge embraced that transparency. We brought in that team together, and it really made a profound impact. I sent this to the mayor already, but I'll share for the rest of you. We did some projections early on regarding the number of deaths in the United States, in Texas, and in Austin. And they were frightening. The number for the United States is 1.2 million. The United States has hit about 92% of that prediction. The state hit about 86% of its prediction so far. the cities of Austin's is 36% of the prediction. And I think that does have to do with the tone that you and the judge set. Has to do with the amazing team that we have in the city, in public health, and certainly all the other EMS and fire departments and emergency management, everybody who came together to make this work. So well done, Mayor, on that. I do want to spend a little bit of time, if you have time, to talk about some of these other folks who really worked behind the scenes while all this was going on. You may know Patricia Pena. When we started, first of all, they asked me to do this October of 2019. So when COVID started hitting, it was just me. And there's other public health staff doing their thing, but as far as the health authority, there was me. So they said, we can give you Patricia to help you out. So Patricia came over. I think she probably really regrets that now. But Patricia was really the glue that made this all work. From organizing the expert panel to sending out hundreds and hundreds of control orders. She's just been outstanding, and certainly could not have done this without her. We'd be on Zoom calls all day, and a plate of food would slide across my desk. You need to eat. So she kept me fed too. I think you've met Dr. Pickett in the past. Or I can't remember how long it lasted, but for a while I was doing the EMS medical direction job and the public health authority job, and then our tuberculosis doctor left, so I was doing that too. I finally said, Dr. Pickett, I need you to be the acting medical director because I can't spend any time over there. And I'm certainly grateful to him for taking on that responsibility. And then later on, pulling him into this public health effort. Because I didn't have time to be in the weeds for many of those important things. The ISOFAC, the Pro Lodge, the alternate care site. That was all this guy. He was the man on the ground. He was the one troubleshooting, working with emergency management, EMS, fire to ensure that not only were the concepts built out, but to ensure that we had adequate health care for those folks. So, Dr. Pickett, thank you. Chris Hewitt in the back. I know you haven't met, Mayor. Chris is a major, lieutenant colonel now. Chris was rotating with us at the time in his EMS fellowship. He was supposed to be here for 1 month doing EMS stuff. He was also doing his Master's of Public Health. So he got a real crash course in public health. But Chris, Patricia was my right hand, Chris was my left hand early on. From building out spreadsheets and graphs to really early on trying to work out contact tracing, going through different products, including Salesforce, to ensure that we not only had contact tracing capability, but that it made sense. We looking at how we triage and prioritize testing, that was Hewitt. So Chris, thank you for that. Jeff Hayes, my former chief of staff, who's now retired, between him and Dr. Pickett, really keeping my team, who I did not see for 18 months. My whole department didn't go to the office for 18 months. So Jeffrey, I appreciate you keeping that together. And of course, my family over here. Today's our 26th anniversary, so happy anniversary. But these people kept me sane. Sometimes insane. But as we struggled with some of the issues, particularly the issues related to schools, I had my school counselor expert who was telling me everything that was wrong with what I was saying, or things that I needed to consider, and it was incredibly helpful. For my kids, I'm sorry I didn't see you for 18 months. You turned out okay, but for them it was, for these three in particular, this was challenging. My stepmother Jerry's down at the end. My father passed away about a year ago. But you know, I'll talk about my dad for just a second, and then I'll close this out. Dad was a Fox News guy. That's all he watched. I want to talk about the importance of that for a second. Too often we surround ourselves by people who think like us. And what my dad provided me was that outside view. And what an incredible lesson that was. You know, at a time in our country, in our city, in our state where we don't listen to the outside view, we don't respect the outside view, we don't understand, we can't conceptualize why they think the way they do, our democracy is lessened by that attitude. And you know, I think this is a lesson for us all, that we've got to listen. We've got to ensure that we are hearing from people who disagree with us, whether it's our parents or other people in the community. We may not agree with what they're saying, but we have to have those discussions. We have to have those conversations so that we can debate and come to a consensus together. So with that, I'll close it out, Mayor. Again, I appreciate it. I appreciate your leadership, and I'm just incredibly proud of the work we've done together, and wish you the best in your future.
Well, thank you.